So the tentative dates of August 2022 exam is from 10th August to 20th August. The finalized date will be informed to you by July end. So please be in contact with me if you want to get any exam related updates or you want to clear any last moment doubts, etc. Please save my number, which I have mentioned in the chat box. Just save that number and contact me whenever required regarding exam, study material, or any other queries regarding your subject or exams. Okay, so contact me on the number which I mentioned in the chat box. Save that. So the tentative dates are from 10th August to 20th August. It may change few days earlier or before, so be in contact with your training managers, relation managers, whomever you have contact with. Save their number. If no, then you can save my number. Okay, starting with the important topics of quality control management, you can expect 70 to 80 percentage of the questions from the topics which I am going to mention in these slides. Okay, um, the pattern of the question is such that 20% it will be tough questions, 70% it will be moderate questions, 10% it will be very easy questions. Okay. So first of all, the function, expectation, and focus of quality control management. It's on page number 3. The dimensions of quality control from hospital's point of view and from patient's point of view. On page number 4, cycle of quality control management. It's on page number 5. Measurement data, the categories, all the tables that is mentioned. Okay, from page number 8 to 19, all the tables that are mentioned, please be very careful. Okay, very thorough in those tables mentioned, and even the images, whatever images we have shown in the quality control textbook, be very thorough in that. Then evaluation step, evaluation tools. It's on page number 21, evaluation tools. Then we have SMART target. Okay, the full form, abbreviation of SMART. Important, some wrong abbreviations will be given. You have to identify the right one. Okay, like that questions will come. Improvement steps, quality improvement steps on page number 30. Then we have models of improvement, important, very important, models of improvement, page number 31 and 32. Medico legal, the entire chapter is important. You can't miss any point here. The entire chapter, medico legal issues, the entire chapter is important. Then patient management guidelines from 43 and 44. Just go through it. Okay, just read through it. It's very easy. Whatever question will be coming from this area, it will be very relatively easy. Just by looking at the question, you will know the answer to it. Okay. Next, the IPSG, International Patient Safety Goals. That's 6 goals. 6 goals, and the explanation to it is given in paragraphs. Just read through the paragraphs, but be very thorough in the headings of these 6 goals. Then we have a spectrum of services. It's just points, okay, from admission to discharge, transfer, referral. Just the points, just read through it. Just go through it once. No need to by heart anything, okay? Patient rights, that 11 points are mentioned. Only that is important. Consent, the difference between general consent, informed consent, okay? Go through all the quality standards just once, okay, from page number 54 onwards. From 54 to 57, all the quality standards for pain management, end of life care. It's not that important. You can just go through it. Very simple questions will come from here. You just read once. Don't miss the topic, but just read once. Then coming to organ transplantation, page number 58 to 61, the consent documentation. It's on page number 59. Documentation of transplant program, important, 4 points. The consent of transplant program. And then the quality standards of transplant program on page number 61. Very important. These 3 topics, very important. Just mark it. Then coming to blood transfusion and anesthesia and surgical care, it's on 60 to 63. Read through it once. WHO safety checklist, surgical safety checklist. You can expect 2 to 3 questions, hard questions coming from here. Okay. Moderate to hard level questions coming from So WHO surgical safety checklist. Be thorough in that. What is given in the textbook will be a little bit tricky for you to understand. I would suggest personally for you to Google surgical safety checklist. If you have attended the classes on this, I must have shown it, the image, but just Google about this, you will get an image. It has 3 columns, okay? Before introduction of anesthesia, before skin incision, and before the patient leaves the operating room. 3 columns in one single image is given. Just by heart that particular image. Okay, you can go to the WHO website or just Google WHO surgical safety checklist. The image will pop up. Okay, save that image and study that. If you find going through this particular page numbers it is difficult, okay, just check that image. You will get the gist of it. Then medication management, the steps. Just read through the steps. Medical errors, very important. What are the different types of errors? Different types of errors, causes of errors, and how to prevent errors. Very important topic. Expect at least 4 to 5 questions from here. Then we have sentinel events and near miss events. Examples are important here. What are the examples of sentinel events? Examples of near miss events. These are important. Okay. Then we have prevention and control of infection. That's the use of gloves and all those things, medical devices, supplies, etc. Just read through it once. Okay. Waste management, in brief, it is given. Just read once. Sterilization, cleaning, disinfection. So from page number 79 to 86, you have to just read it once. Food services and food safety. The levels of different classes of food services, class categories, class 1, class 2, class 3, important. Okay, which criteria makes it class 1, class 2, class 3, that is important. Food safety program, on page number 92 you will find a hazard table, that is important, and the 3 points which is given. Okay, requirements of a food safety program, that's important. So by heart that. Then TB infection control, you have 10 steps. By heart those 10 steps. Okay, just read through the point paragraphs which are given under the 10 steps, but by heart the 10 steps. Okay. Utility management, just read once, especially which is about the utility management. You have a specific page points. Okay, from potable water, how much potable water is available, how oftenly you have to check the potable water, non-potable water, how often you have to check. Okay, that you have to read once. Then water supply, the tables are there and the points only that. The table which has these many liters of water is required per consultation, per OPD consultation, IPD consultation. Okay, what is the amount of water required for each patient or each consultation? A small table is given on page number 115. You have to be thorough in that. Okay. Then coming to accreditations, it's on page number 172 to 177. The abbreviation of all the accreditation, the major functions of these accreditations. Okay, that is important. Power, communication, washrooms, just read once. Okay, just go through it once. Hand hygiene, very important. 5 moments of hand hygiene, that's the important question. Labor room, the table, just go through it. I don't think so there will be any questions from labor room. It's just for your understanding. ICU planning from page number 128 to 151. Difference between ICU, HDU. Okay, different levels of ICU. What makes an ICU level 1, level 2, level 3? Key differences. When you read these points of different levels of ICU, you will understand it. Mark those important points. Okay, questions will come from that. HDU, which in which all cases you will use HDU. How is HDU different from ICU? That is important. HIV services, all the tables which comes under HIV services, that's important. Waiting area, pharmacy tables. Okay, 5S model. Then medical records department, which we have discussed just now. Read all the points once. And electronic medical records, same points. Just read the points once. Human research, just read it once. So this is 2 sample questions which I'm showing you. This kind of questions you can expect for exams. Okay. The difficulty criteria, moderate and easy criteria will be something regarding to this. So res judicata doctrine means what? Things that have been decided. Okay, you have some Latin words used in the medical legal chapter. Okay, so you have to be very clear about which Latin Latin phrase stands for which medico legal issue. Okay. Then noise level in ICU. If you're thorough in the ICU chapter, you would know what should be the noise level at night during ICU. So I have marked the answer in bold, so it should be below 40 A-weighted decibels. So these are the just two examples of two sample questions. If you have any doubt regarding the exams, if you have any queries, just put in the chat box, I'll reply to it.